The Surgeon General is calling for warning labels on social media websites because of the harm that they can cause to children.
News 8's Kyle Mitchell is in studio now with concerns that a local psychologist has about the platforms. Kyle?
Sue and Brian, a Corewell Health pediatric psychologist says social media can have lasting impacts on children into their lives as adults.
As the number of social media platforms keep growing.
In the research, we have known that increased social media usage does increase the likelihood or the risk for things like depression, anxiety, low self-esteem.
Dr. Adele Kanju, a pediatric psychologist with Corewell Health Helen DeVos Children's Hospital, sees the impacts firsthand.
Social media sites, they're set up to be engaging and entertaining. And so they make them very, interesting for our youth. And so it is hard for a lot of kids to put the social media down or to disengage from it. And that can be a challenge because it then means they're not engaging in other activities.
Social media companies are required by federal regulators to not allow children under 13 on their platforms, but they often find ways around the restrictions. The Surgeon General says the site should be regulated for safety, similar to other products children use, like car seats or baby formula, and need warning labels.
One of the things that we see is that, particularly in youth, because they are developing a sense of themselves, what happens is that by engaging in social media, our self-worth gets tied to things like how many likes we get, as opposed to what our actual skills, abilities, characteristics are. And that can be very detrimental to their development of self-worth.
Platforms are under scrutiny to regulate and remove harmful content.
Social media provides a very easy way for bullying. And so we see a tremendous amount of cyberbullying that occurs on social media. And that cyberbullying has long-term effects on the mental health of our kids. And so we are allowing them to engage in something that can be very, very detrimental to their social interaction.
Dr. Kanju wants parents to have a long conversation with their kids when deciding if they should be on social media.
It's important to first understand, why does our child want it? What do they want to use it for? How would we want them to use it, so that we can begin guiding them down that path of a healthy relationship with social media.
Doctors suggest having phone and electronic free time for kids and for parents. Sue.